is the brachial plexus. So brachial plexus is the group of nerves which supplies the upper limb. So there are many branches and there are many nerves which arises from the brachial plexus. So we will discuss about the brachial plexus in this video. So the brachial plexus mainly arises from the C5, C6, C7, C8 and T1. So when C4 is contributed, it is named as prefixed brachial plexus. Whereas when T2 is contributed, it is referred as postfixed brachial plexus. Coming to the components of the brachial plexus, we have root, trunk, divisions and the cords. So coming to the root, as I said, it arises from the C5, C6, C7, C8 and T1. Trunk. There are three trunks in the brachial plexus: upper trunk, middle trunk, lower trunk. We will see how it is formed. See here, these are the roots. So C5 and C6 forms the upper trunk. Okay. C7 forms the middle trunk. C8 and T1 forms the lower trunk. So these are the three trunks in the brachial plexus. Coming to the divisions. So all these trunks is divided into anterior and posterior divisions. See, upper trunk is divided into anterior and posterior. Middle trunk is divided into anterior and posterior, as well as the lower trunk is divided into anterior and posterior. Coming to the cords. In the brachial plexus, we have three cords: lateral cord, middle cord, and posterior cord. So, the lateral cord is formed from the anterior division of the upper trunk, anterior division of the middle trunk. So, these two forms the lateral cord. Coming to the middle cord, it is formed by the anterior division of the lower trunk. That's it. And coming to the posterior divisions, so posterior cord, it is formed by the posterior divisions of all three trunks. So it is formed by the posterior division of upper trunk, middle trunk and lower trunk, which is referred as posterior cord. So these are the components of the brachial plexus. So coming to the branches of the brachial plexus. Branches arises from the root, trunk and the cords. So we will see the branches which arises from the root: dorsal scapular nerve and long thoracic nerve. So dorsal scapular nerve, which supplies the levator, scapulae and rhomboids major and minor muscles, whereas long thoracic nerve supplies the serratus anterior muscle. Coming to the branches of the trunk, we have two branches: nerve to subclavius and suprascapular nerve. Nerve to subclavius is nothing but it supplies the subclavius muscle. Suprascapular nerve, which supplies is the supraspinatus, infraspinatus muscles. Coming to the branches in the cord, we have three cords. So from the lateral cord, we have three branches such as L, L, M. Lateral pectoral nerve, lateral root of median nerve, musculocutaneous nerve. Lateral pectoral nerve, which supplies is the pectoris major, pectoris minor muscles. Lateral root of median nerve forms the median nerve. Musculocutaneous nerve, which supplies the biceps brachii muscle, brachialis muscles, which is the anterior compartment of the arm. And coming to the branches of the medial nerve, we have 5 branches such as 4M, 1U. So medial pectoral nerve, which supplies the pectoralis major and minor muscles. Medial root of median nerve forms the median nerve. Ulnar nerve, which is the major upper limb nerve, which supplies major hand muscles. And medial cutaneous nerve of arm and medial cutaneous nerve of forearm, which is the sensory nerves of the forearm and arm. Coming to the branches of the posterior cord, axillary nerve, which supplies the teres minor and deltoid muscle. Coming to the radial nerve, which is also a major upper limb muscles, And to know more about it, I will give you the link in the description for the radial nerve. Coming to the thoracodorsal nerve, which supplies us the latissimus dorsi muscle, whereas upper and lower subscapular nerve, which supplies the subscapularis muscle. So these are the nerves arises from the brachial plexus and supplies us the muscle. And coming to the applied aspect, we have two, that is Erb's paralysis and Klumpke's paralysis. Erb, the injury in the brachial plexus, we have two clinical significance. One is Erb's palsy and Klumpke's palsy. So Erb's palsy is the upper trunk injury, whereas the C5 and C6 roots get damaged, so that the clinical features are the wider tips hand in the cells, or the, we can say it as policeman tips hand posture. So the hand becomes like that. And what are the muscles involved in the Erb's palsy or deltoid, supraspinatus, infraspinatus, brachialis, brachioradialis, all these muscles. So coming to Klumpke's palsy, it is the lower trunk injury, and the C8 and D1 gets damaged, and the claw hand will be seen. Claw hand in the metacarpal phalangeus joint will be extended, whereas interphalangeal joints will be flexed, which is referred as claw hand. So this claw hand can be seen, and then all intrinsic muscles of the arm gets affected. So these are the clinical significance of the brachial plexus. Erb's palsy can also lead to the Horner syndrome. So in this syndrome, the T1 is mainly affected, so which gives the symptoms of sample. It is the mnemonic. So SAMPLE, sample. Okay. S stands for sympathetic chain will be affected. A for anhydrosis. The sweating will be not normal, it will be reduced. So M is the mitosis. Meiosis. Meiosis in the sense construction of the pupil. Whereas P, ptosis. Whereas drooping of the eyelid will be taking place. So L, loss of spinobiliary reflex will be affected, will be lost. Coming to the E, enthalasm, which is the eyes will be get inside. It is not protruded out. So these are the symptoms of the Horner syndrome, which comes under the Erb's palsy. Thank you.